Hello everyone. At the outset, I would like to inquire about your health, your family's health, and I hope and pray that all of you are keeping safe. As you all know, the COVID pandemic has changed the entire world. It has affected us physically, emotionally, mentally, socially, and economically. This has been a difficult time for everyone, especially the medical fraternity and the hospitals, of course. The demands and expectations on the doctors and the hospitals are tremendous from both the public and the government. And we have been giving our 100% to meet these demands. For the past 6 months, the medical teams and support staff have been working non-stop. And for your kind information, none of us have taken off since the onset of this crisis. Many of us are living separately from our family. We have not been seeing our spouses. We have not been seeing our kids. And we have not been seeing our parents for lengthy periods of time. Many of the doctors and staff themselves have been affected with this illness. Many of the doctors and staff have lost their beloved family members. Many of us have lost our lives fighting against COVID. And with the strict COVID protocols in place, most of the hospitals are working with 50% of the staff.
Dear friends, COVID-19 is a pandemic which has created havoc across the globe. We are tirelessly fighting against something very invisible and deadly. Medical fraternity across the world are trying to find a cure, but none of them have proven efficacy so far. In the recent times, humanity has witnessed many COVID-related deaths, helplessly waiting for a ray of hope. In these difficult times, we are definitely looking for a treatment or a vaccine which is currently unavailable. The mainstay of treatment remains purely supportive. Many a times, even with the best of supportive care, some patients wouldn't just respond purely because of their coexisting illnesses. We must all remember just one thing: old age, disease and death are inevitable. We are not immortals and medicine cannot cure every disease. However, on the brighter side, there is definitely a good news. Majority of COVID patients are recovering very well, including patients on ventilator or on their recovery path.
Dear all, death of a patient is always a very sad event in any hospital. It causes irreplaceable loss for the family. It's definitely disheartening for the doctors and nurses who tried their best to save them. Death is a reality of medical science. Hospitals are places where lives are saved day in and day out. But as this is also a place where the sickest in the society end up, death is also inevitable. We always empathize with the family of the deceased. But using these incidences to attack the already overworked medical fraternity is really demoralizing. It is humiliating to us. Attacking hospitals with completely fabricated stories and social media posts and posters is an irresponsible and a malicious act. This is overtaxing the mental and emotional strength of the already overburdened medical and supportive staffs. This is a fight which has to be fought together. This is a fight which has to be fought by all members of the society, not just the medical fraternity. Attacking hospitals and doctors is unlawful, unfair, and totally unacceptable.
Today, our hospital is the victim. Our doctors are made victims. Tomorrow, it's going to be another hospital, another doctor. How long? Are we not the part of this community we are living in? Are we not your fellow human beings? Why is that only when something goes wrong in the society, we are always faulted? Why is that only one section of the community cornered? Why is that only one section of the community always victimized?
Hence, we have an appeal to the public. Even if you don't support us, please don't punish us. Even if you don't promote us, Please don't humiliate us with fake news. Please be responsible citizens and support this fight against COVID. Thank you all.